Question number 101. A 45-year-old male was working on his roof when he fell approximately 12 feet, landing on his feet. He is conscious and alert and complains of an ache in his lower back. He is breathing adequately and has stable vital signs. You should A. Obtain a Glasgow Coma score value and give him oxygen. B. Perform a focused physical exam and immobilize his spine. C. Allow him to refuse transport if his vital signs remain stable. Or D. Perform a rapid trauma assessment and immobilize his spine. D is definitely the best answer here, yes. The fact that he fell 12 feet, that's a pretty substantial height. I think your book lists 15 feet or 3 times a person's height, I think. You'd have to check in your book because I believe it's slightly different depending like who is defining that. But 15 feet is like a critical, serious, significant, whatever the word they use, amount to fall. And so 12 feet is pretty close. He fell landing on his feet, so what kind of injuries are we expecting? Anything where that impact is like between 2 bones or joints, anything like that. So certainly his knees, hips, all of his joints that support his weight. Potentially in his spine, talking about some sort of compression injury. Because remember all those vertebrae and all the discs in between, that's a lot of force to be transmitted all the way through that column. So you'd expect to see some of those injuries with this patient. And it makes sense then that he's got that ache in his lower back. So the rapid trauma assessment allows you to quickly see if there's anything else going on, and you would immobilize his spine because of that ache and the fact that it was a pretty substantial fall. Number 102. You are assessing a 30-year-old male with an amputation just above the left wrist. He is conscious and alert and has a patent airway. Dark red blood is freely flowing from the injury. You should A. Administer supplemental oxygen. B. Perform a rapid trauma assessment. C. Attempt to locate the amputated part. Or D. Apply direct pressure to the injury site. D, again, is the best answer. And none of these are bad answers. They're all things that you would do for your patient, but you can tell this question is clearly pointing towards fixing or managing, anyway, this bleed. Dark red blood, freely flowing, what kind of bleed is it? It's a venous bleed. Remember, arterial would be bright red and spurting, and capillary would be more of an ooze. Yeah? Okay. You would want to locate the amputated part. You would want to do a rapid trauma assessment. You would want to give oxygen, but this one is so clearly pointing towards managing that injury that the answer has to be D. Number 103. A young male was assaulted and is found unconscious. Your assessment reveals bruising around his eyes and blood-tinged fluid draining from his nose. You should be most suspicious for or of A. Skull fracture, B. Cerebral contusion, C. Subdural hematoma, or D. Intracerebral hemorrhage. Best answer here is A. skull fracture. That bruising around the eyes, we call that raccoon eyes. It's like the tissues underneath the eyes are filling up with blood, like a really dark bruise. The blood-tinged fluid, what is that maybe telling you? What fluid would you expect to be draining out? Yeah, potentially CSF, cerebrospinal fluid, also blood-tinged, so there's some blood mixing in. I mean, it may just be some mucus, just what you would normally have coming out of the nose, but when you talk about a fluid draining, we're thinking CSF, and then obviously some blood mixed in as well. Based on those 2 signs, it's pretty clear that it has to be a skull fracture. Another thing you might see with a patient like this would be what we call battle sign, which is bruises kind of behind the ears. And it's a sign of specifically a basal skull fracture, which means that the bones more towards the base of the skull would have fractured. For a patient like this, you'd want to be careful. You would not put in an NPA. If they needed an airway, you might put in an OPA if appropriate, but certainly not an NPA. Why? Because the way those things go in, if you have a skull fracture in the right place, remember, it can go through that opening and actually into the brain space, which would be really dangerous. So definitely skull fracture. Based on these others, cerebral contusion is like a bruise on the brain, will often cause bleeding and swelling. It's bad, but it doesn't make sense here. Subdural hematoma, do y'all remember the difference between a subdural and an epidural hematoma? So a subdural hematoma is a hematoma. First of all, hematoma meaning that it's bleeding. Subdural is where it is bleeding between the dura mater and the arachnoid mater. The dura mater is the outermost layer of the meninges. Arachnoid mater is the next one down, and there's a pia mater even below that. So it's bleeding in between the layers that surround the brain, putting pressure on the brain. An epidural hematoma is bleeding between the dura mater and the skull, so outside of all the meninges. And then intracerebral hemorrhage would be bleeding inside, within the brain itself. So all of these would be bad, but B, C, and D, we don't have any signs that specifically point to them here. Number 104. The driver of a sport utility vehicle lost control and struck a utility pole head on. The driver was killed instantly. The passenger, a young female, is conscious and alert and has a few small abrasions to her left forearm. Treatment for this passenger should include A, a focused exam of her forearm, B, transport to a community hospital, C, performing a rapid trauma assessment, or D, allowing a friend to drive her to a hospital. C. We had a question sort of like this earlier where we talked about mechanism of injury. Remember, in any sort of collision like this where one person is killed, you have to assume that everyone in the car experienced that same degree of force, that same mechanism of injury. So you're automatically going to assume that they need trauma care, even if it's not obvious. And maybe they don't. They may actually be fine. You do see cases like that where one person is killed and one person walks away without a scratch. But we don't make assumptions like that, so we have to start off assuming that they may have something just as bad as their friend did. Even though she has those small abrasions to her left forearm, we're not going to assume that is the main problem. We have to do the whole rapid trauma assessment. 105. During your rapid trauma assessment of a patient with blunt chest trauma, you note paradoxical movement of the left chest wall. As your partner is administering oxygen to the patient, you should A, request a paramedic to decompress the chest, B, make note of it and continue your assessment, C, stabilize the chest wall with a bulky dressing, or D, reassess the adequacy of the patient's breathing. So what's happening with this patient? Yeah, remember, paradoxical movement is when the rest of the chest is moving in one direction and that particular patch is moving in the opposite direction. So typically you're breathing and you're exhaling and your chest kind of moves like down because that's how the ribs move when your diaphragm is relaxing like that. But that piece of your chest is going to move out because it's experiencing the same pressure that your lungs are, and it's not tethered to anything that would make it stay in one place. So it's going to be moving out when the rest of your ribs are moving down and in. Likewise, the reverse is going to happen. When you're breathing in, it's going to be sucked in as well because all that negative pressure inside your chest is affecting it since it's not attached to the ribs it's no longer attached to the ribs that would be controlling the rest of your movement. We also call that flail chest. So the correct answer here, yes, is C, stabilize the chest wall with a bulky dressing. That's how you deal with flail chest or paradoxical movement. Bulky dressing to kind of keep it in place. You don't want to put a lot of pressure on it. It is ribs, but you do want to put something there that's going to help it not move so much in and out. 106. A child who has no recent history of illness appears suddenly cyanotic and cannot speak after playing with a small toy. You should A, perform abdominal thrusts, B, visualize the child's airway, C, perform a blind finger sweep, or D, give oxygen and transport at once. A. A is the best answer. In this case, you would automatically start with your abdominal thrusts.
So you don't check it first?
You don't have to look at the airway right away. You probably wouldn't expect to see anything. Eventually, you do want to look at the airway, more so if they become unconscious. You want to immediately act and try to get it out. It's your best assumption at this point because of what we see here. If the child became unconscious, you'd lay them down, you'd open the airway, and then try to look in to see if you could do a finger sweep. Remember, never a blind one, so you don't just feel around to see what's there, but you would try to see if there was anything and then pull it out if you could. And remember, if it was a really small child, this just says a child, so we assume a general pediatric patient. But if it's an infant, do y'all remember what we do instead of abdominal thrusts? Back blows. Back blows and the little chest thrusty things, like 5 and 5. 5 back blows, 5 chest thrusts. 107. The central nervous system, CNS, consists of the A, cerebellum and brain, B, brain and spinal cord, C, cerebrum and meninges, or D, meninges and spinal cord. B, brain and spinal cord. The peripheral nervous system is all of the extra motor sensory nerves that are in your body. Everything else is like listing specific parts of the brain or the different parts. 108. During your assessment of a 29-year-old female with significant deformity to her left elbow, you are unable to palpate a radial pulse. Your transport time to the hospital is approximately 40 minutes. You should A, splint the elbow in the position of deformity and transport immediately. B, apply gentle manual traction in line with the limb and reassess for a pulse. C, carefully straighten the injured arm and secure it with padded board splints. Or D, make 2 or 3 attempts to restore distal circulation by manipulating the elbow. So I'm hearing multiple options. We'll just talk through. A, splint the elbow in the position of deformity and transport immediately. This would not be the correct answer. What does it not take into account? You don't have a pulse. You cannot find one. And also, your transport time is 40 minutes. So it's not an insignificant amount of time for her arm to be going without circulation. They put that time, not to say that if it said 5 minutes, the answer would necessarily be different, but they put in that long amount of time to make it clear to you that you have to do something. You can't just not do anything and say it's probably going to be fine. You need to take care of your patient in some way. So when we have a patient who has, when we say this significant deformity to her left elbow, we can think of it being a dislocated elbow. Remember, that's usually what happens with joints, is that something moves out of position. It's not that it's a broken anything, but something is torn or moved out of position. And there's a significant amount of deformity. So what is the best way to deal with this sort of deformity? The 3 options that we seem to have are manual inline traction. Y'all know what that is? Traction is essentially putting very light tension on something, like when we use a traction splint on the femur, it's putting a light amount of tension on the femur to pull it back to a normal position. Not extremely so that it's going to hurt worse, but the idea being pull it back into a reasonable functional position. We talk about the position of function with things. And that's the goal of traction, pulling traction on a patient. Straightening the injured arm is the other option they give us. Or they say manipulating the elbow, and they don't really give us any detail. Between these 3 options, what's the one that we think is least best? D, manipulating the elbow. Yeah, you don't want to just kind of work it around to try to figure something out. You don't ever want to do kind of purposeless movements that are just hopefully something works. You want to have a real distinct plan. And that's why between B and C, the best answer is B. Gentle inline traction with the limb, just enough tension, just enough movement on it to get it to a position that it's supposed to be in, sort of. You don't have to fully straighten the arm because that is probably going to cause some pain. Just enough, though, that you can hopefully try to get some pulse that you can feel in the distal area. 109. A 40-year-old unrestrained female impacted the steering wheel of her vehicle with her chest when she hit a tree while traveling at 45 miles per hour. She is conscious and alert, but is experiencing significant chest pain and shortness of breath. Which of the following injuries has this patient least likely experienced? A, head injury, B, cardiac contusion, C, pulmonary contusion, or D, multiple rib fractures? A. We had the other question like this where it's like, which one is least likely? We were talking about the eyes or something, like he had a light headache, and it was a question of why his eyes are dilated because we didn't know if it was eye surgeries or this or that or head injury. The wrong answer, or the correct answer, the thing that was least likely was head injury, because there's nothing to point to a head injury. In this case, head injury, because there's nothing to point to a head injury. All the stuff we have out of this question is talking about chest things. And so that's why it's least likely that there's a head injury going on. We don't know out of the others which ones make most sense here, but significant chest pain, shortness of breath, and also remember, she's got that impact to the steering wheel. And we've talked about how that is a very sturdy part of the car. If that impacts your chest, you're probably going to see some significant chest trauma, blunt impact trauma to the chest. So cardiac contusion, a bruise to the heart muscle, yeah, that could totally happen. Pulmonary contusion, bruises to the lungs could totally happen. Multiple rib fractures, you'd expect that. All of this stuff could happen with that blunt chest trauma. 110. A 22-year-old male was walking on the beach and had sand blown into his eyes. He complains of pain and decreased vision to his right eye. Treatment should include A. Irrigating his right eye laterally, B. Flushing his eye starting laterally, C. Irrigating both eyes simultaneously, or D. Covering both eyes and transporting. So I had to talk about this one to Randy a little bit because I didn't feel like some of those were worded very clearly. The best answer is A, and I'll explain why. It's having trouble connecting. Seriously? Oh my god. Okay. So y'all can't see that it's totally screwing me over right now. That's fun. Thank you, system. Having to log in and everything.